Cystic acne is the term most people use, but what doctors are really describing is nodulocystic acne. This form of acne involves deep, painful bumps under the skin that can last for weeks and often leave scars. Unlike mild acne, which stays on the surface, nodulocystic acne forms deeper in the skin and includes large inflammatory nodules and cyst-like lesions. It is one of the most severe types of acne and really often requires prescription treatment rather than over-the-counter products. Hi, my name is Dr. Morgana Colombo. I'm a board-certified dermatologist and founder of Vida Derma, a science-backed skincare line. Let's get to the top 5 causes of nodulocystic acne and how to treat it. Hormones and excess oil production are one of the main causes of nodulocystic acne. One of the biggest drivers of nodulocystic acne is androgen hormones like testosterone. These hormones cause oil glands in your skin to grow larger and produce more oil, also known as sebum. When too much oil is produced, it clogs pores and creates the ideal environment for acne to develop. This is why nodulocystic acne is common during puberty, around menstrual cycles, and in conditions like PCOS. Studies have shown that many patients with severe acne have signs of increased androgen levels. The best way to treat this cause is by reducing oil production and balancing the hormones. Doctors often recommend topical retinoids, hormonal treatments such as like spironolactone or birth controls, and in more severe cases, isotretinoin or Accutane, which directly reduces oil production. Number 2 is clogged pores. Clogged pores caused by abnormal skin cell turnover play a major role in nodulocystic acne. Your skin naturally sheds dead cells, but in acne-prone skin, this process does not work properly. Instead of shedding normally, the cells stick together and block the hair follicle, forming what is called a microcomedone. As the pore becomes blocked, oil builds up underneath the surface. This buildup can lead to the formation of deep nodules and cysts. The best way to treat this is by keeping the pores clear and improving skin cell turnover. Topical retinoids like tretinoin or adapalene are the most effective treatments for this. Other helpful options are going to be salicylic acid and benzoyl peroxide, which help prevent clogging and reduce acne formation. Number 3, guys, is bacteria, a type of bacteria called Cutibacterium acnes, C. acnes, formerly P. acnes, contributes to the development of nodulocystic acne. This is a bacteria that normally lives on the skin, but in nodulocystic acne, it can overgrow and trigger inflammation. This bacteria can also form protective biofilms, making it harder to treat. Recent research shows that certain strains of this bacteria are more likely to cause severe inflammation and worsen acne. Treatment is going to focus on reducing bacterial growth while avoiding resistance. Benzoyl peroxide is one of the most effective options because it kills without causing resistance. Doctors may also prescribe topical or oral antibiotics like doxycycline, but these are usually used for a limited time and always combined with benzoyl peroxide if you're using a topical antibiotic especially. Another cause that contributes to this type of acne is inflammation. Unfortunately, inflammation is a key factor that turns mild acne into severe nodulocystic acne. Acne is not just about clogged pores, it's also an inflammatory condition. In nodulocystic acne, the immune system becomes overactive. A specific pathway called the Th17 inflammatory pathway is involved, leading to redness, swelling, and painful deep lesions. This inflammation is what causes small acne lesions to turn into large painful cysts. Treatment focuses on calming inflammation. Oral antibiotics help reduce inflammation, and isotretinoin or Accutane works on multiple pathways, including inflammation. In some cases, dermatologists may inject corticosteroids directly into large cysts to reduce swelling and pain. Finally, the fifth cause is genetics and family history. This significantly increases the risk of developing nodulocystic acne. If your parents had severe acne, your chances of developing it are much higher. Research shows that having a family history of acne increases your risk by nearly 3 times. Genetics affect how much oil your body produces or your skin produces, how your immune system responds to inflammation, and how your skin cells shed. Although you cannot change your genetics, you can treat acne early and aggressively. This often means starting prescription treatments sooner and not relying only on over the counter products. Early treatment is critical to prevent permanent scarring. First, let's talk about initial therapy for this. First line treatments for nodulocystic acne typically include combination therapy. For moderate to severe acne, dermatologists recommend a stepwise treatment approach. This usually starts with a topical combination therapy, including a retinoid and a benzoyl peroxide, with or without a topical antibiotic. Oral antibiotics like doxycycline are often added for more severe inflammation, and steroid injections may be used for large painful cysts. These treatments can help control acne, but they're often not enough for severe nodulocystic acne. Isotretinoin or Accutane is the most effective treatment for severe nodulocystic acne. For true nodulocystic acne, isotretinoin or Accutane is the gold standard. It works by targeting all the main causes of acne, including oil production, clogged pores, bacteria, and inflammation. Treatment typically lasts 6 months, and many patients experience long-term or permanent improvement. However, Accutane requires careful monitoring, including blood tests and strict pregnancy prevention, because it can cause severe birth defects if you get pregnant while taking it. Not a problem for males. Common side effects are going to include dry skin, dry lips, dry eyes, but those are usually temporary and reversible by reducing the dose or stopping the medication. Now, when all of those are not enough, we need to go to the next step. Second line and alternative treatments are available when first line options are not enough for nodulocystic acne. Dermatologists may recommend hormonal therapies such as spironolactone or birth control pills, especially in women. Other options are going to include different oral antibiotics such as minocycline or sarecycline, and newer topical treatments like clascoterone or Winlevi, which blocks androgen effects on the skin. These treatments are often used when hormones play a major role or when isotretinoin is not a good option. The key takeaway is that nodulocystic acne requires early and aggressive treatment to prevent scarring. Nodulocystic acne is not just a cosmetic issue. It's a complex inflammatory condition involving hormones, clogged pores, bacteria, inflammation, and genetics. Over-the-counter treatments are usually not enough. Early treatment with prescription medications is essential to prevent long-term skin damage, aka permanent scars. If you're dealing with deep, painful acne that does not go away, it is important to seek treatment early. The sooner it is treated, the better are your chances of preventing permanent scars and achieving clear skin. What questions do you have about your skin? Drop them in the comments below and I will do my best to answer them. Remember to hit like and subscribe, and I will see you in the next one.